Dr. Coury, great to see you.
Nice to see you.
Yeah, thanks for sitting down.
Having me.
Oh my gosh, you bet. Thank you so much for being here. Tell me a little bit about like where you are today. I'd love to hear your origin story or like, just how you got to this point today.
Thank you. So I'm currently a fellow at Columbia. So Dr. Lanke, one of the main surgeons that's here, he's my mentor. I actually did residency also at Columbia, so I've been there now. This is my 6th year. And before it was regular orthopedics, I'm ortho trained, and then now I'm focusing on adult spinal deformity surgery. So
That's really exciting.
it's been awesome. It's nice to finally focus in and just do what I've really wanted to do. I enjoyed hip and knee replacements and trauma, but it's nice to focus on spine finally.
When did that aha moment that this is what you wanted to do you recall when that was?
That's a great question. I do actually. I was in a pediatric scoliosis case as a 2nd-year resident, and that's when I said, this is the most amazing thing I've ever seen. This is what I want to do the rest of my life.
2nd-year residence, pediatric scoliosis case. So at that point, you don't know yet, because help me understand. So how many years and all that, maybe for the audience?
Yeah. So medical school is 4 years. You go after college for 4 years. And then orthopedic residency is 5 years. And usually the first 2 years, it's mainly in the ER, helping a bit in the OR. And then the last 3 years are really when you learn how to do surgery and you're in the OR. And then you usually do 1 to 2 years of fellowship after residency.
That's great. So it's like you kind of had those last 3 years, you were already like, this is it. You're not trying to decide at that
Doing a lot of spine then. Yeah.
And a great mentor to be under.
Absolutely, definitely. Columbia has a great program. We also have Dr. Lehman who's there, and then Dr. Rue, but we don't work with him until we're fellows actually. So
Gotcha. So now you're a fellow, and what is happening now? Like you're here at this meeting, you're interacting with your deformity community. Kind of walk us through that a little bit.
next. Yeah, so after the fellowship process, you kind of have to decide if you'd rather be an academic surgeon in the future or more of a private practice surgeon. And really, the only difference is whether you're involved in research and going to meetings like this. And so now I'm actually doing a 2nd fellowship, a Peds Spine fellowship, also with Dr. Lanke. So I do have 1 more year, but now is when I start to look for jobs, and I want to be academic and keep going to awesome meetings like this. So it's an interesting process trying to find an institution where you can fit in and match the culture and be a part of the research that they're doing.
No, 100%. And it seems like there's not like some one process. It's very much organic to, right, what type of a practice you would like to join or start or, right? So
Definitely, it is, and it's interesting because a lot of other fields, there's like my friend is going into trauma, and they post all the jobs online. Everybody goes to the one trauma meeting and interviews, and then everyone gets distributed to their jobs. But spine is a lot more of who you know, what culture do you fit, where do your goals align with what they're doing, and just really what your future ambitions are and what institution would match those.
well, and also as we talked about a little bit yesterday, like it's also who knows you, right? So you're coming to these meetings, you're interacting. There's a little bit of networking here, right?
It is. It's really nice, and this is my 4th year actually at ISDS. Since I've been at Columbia, I've been able to keep coming, and I find that each year there's more people that I get to know and a new face that becomes familiar. So it's a really awesome opportunity to get to be here.
That's great. So take us through, like, if you have, like, nobody has a crystal ball, but like, how do the next few years play out? Like, what are you looking for? Where's that going to be? Maybe part of the country? Do you like the Northeast, or I mean, whatever you'd like to share?
I'm not sure really where I want to be location-wise. I think the most important thing to me is the institution, that I really like being involved in research. At Columbia, we do so much research. We just applied our abstracts to Global Spine Congress, and we submitted 33, and all 33 were accepted. And I think I was involved in about half of the projects, actually, because I find it all so fascinating. Spine completely evolving and changing every year, and the research really is so important to pushing that forward. So I think first that would be the most important thing to me, a place where people are passionate about research. It doesn't have to be an institution that does a lot, even if it's just a place that's open to me bringing research and starting to do it. And then also I really want to be involved with scoliosis and deformity patients, and that patient population isn't everywhere. So I guess I'd have to be in more of a city area where there are those patients that need help.
So you've had Dr. Lanke and Dr. Lehman, and they're both well-known, great surgeons, different style, robotics, open, right? So do you get a sense for, as it relates to enabling technology, is it going to be a big part of your practice? I mean, how does this you get to kind of experience it all at Columbia, and then as you look to where you're going to go next, like I'm just curious, honestly.
Yeah, it's definitely it's one of the things I'm so thankful about with my training because a lot of places love robotics and that's everything they do. But at Columbia, Dr. Lanke has never used the robot or navigation. So with him, we really learn how to do everything based off of anatomy. And then with Dr. Lehman, we have the opportunity to see all the enabling technology. And he's really incorporated it in a way that it's still very safe, where he's verifying everything he's doing also with anatomy. So I think it's just going to be nice to know both things. And I think that when I'm doing a revision case where the anatomy might not be straightforward, I'm definitely going to use the enabling technology. And then if it's a straightforward case, I personally think it's faster to not use robotics. I bet someday that'll change. So in those cases, I would probably just do it the old school way.
One could get into trouble if they are so focused on enabling technology that they forget the anatomical marking, the feel, just like how to place if potentially the power goes out or the robot doesn't work. What do you do?
Exactly. That's so important. And I also am involved in an organization called Global Spine Outreach that Dr. Mundis, who's here, is a big part of. And so we go abroad and help patients with scoliosis, especially early onset and neuromuscular, where really the surgeries are life-saving. If patients don't have them, their life expectancy is decreased by a lot. So when we go there, they don't have any of the fancy technology. There is nothing, and they go to Mexico, Colombia, Brazil. So there we're using technology from 30 years ago that's donated by the companies. And so it's really important if you want to be somewhere that's not a major, city area to know how to do it the old school way. So
Big fan of Global Spine Outreach. I'm glad you mentioned that. Talk to me about, because I've been to Africa on a medical mission trip before, and it is unlike anything. It's hard to describe. Just in what you said, the lack of resources, the ratio, particularly in Africa, of like there's so many more people than doctors. It's like flipped. So what is that like for you as a surgeon, as a spine surgeon? It's got to be especially meaningful for those kids, right? That pediatric.
definitely. And I think that a lot of organizations do it in the medical tourism way, but Global Spine Outreach, they do not. When we have a clinic the first few days, and I saw a patient that was 10 years post-op from one of their surgeries. So they actually follow up all of the patients, watch them grow over time, and there were so many that were so excited to see Dr. Mundis. They love him so much there. But yeah, it was just such a rewarding experience to really be able to help children who otherwise would not get surgery. In the healthcare system in Mexico, spine surgery is so expensive and it usually ends up out of pocket. And even if you have health insurance, but I think it's something like 10% of the country has health insurance, so people really don't have access. And again, neuromuscular patients, if they grow up with scoliosis, their lungs are compressed, their heart's compressed. We saw a child who both their lungs and heart, and actually it was so bad that they also had a bowel obstruction. It literally was such bad scoliosis, it pressed on all their bowels, their colon. So it was very rewarding to be able to help that. And also to teach, we are involved with the local surgeons too. So Dr. Mundis teaches a lot of the local surgeons, not just how to do the surgery, but how to do it safely, which I think is so important to show them all of his techniques to make sure that the patient's safe.
No, absolutely. Well, that's just such a great cause, and thanks for sharing that. What would you say to an institution, like you're in this kind of place where you're looking at applying and matching and like figuring out where it's going to be? What would you say to them? Like, who are you as a surgeon? Who do you want to be, right?
I guess I would say first and foremost, at my core, I went into this because I really want to help spine patients. And every time I see one of these spine patients that has terrible deformity, terrible disability, that lives life in constant pain, I just feel I want to do everything I can to help them. And I think that with spine surgery, you can completely change someone's life with a procedure. You can take someone who hasn't walked upright in years and help them get back to the activities that they love. And children who have restriction on their lungs to help them to breathe normally. And so I think at my core, that's the most important thing to me, is helping as many people as I'll be able to. And then second, we kind of spoke about that I think that a lot of orthopedics is optimized. In hip replacements, 99% of people love their hip replacement and have an excellent outcome. But in spine surgery, the techniques are constantly changing and evolving. every year there's a new device, a new technique that can hopefully optimize patient outcomes. So I like to be a part of a field that's evolving, and that's where the research plays in for me, that I want to do what I can to help improve spine surgery and the outcomes for patients.
Well, you've got a wonderful career ahead of you, and just honored to meet you, sit down here and spend a
Nice to
little
meet you
time.
too. Thank
Yeah,
you
it's
so
just fun.
much.
Go
This
Lebanese.
was.